go ahead and start.
Yep.
Hi, I'm Andy. I work for the mobile unit. I'm a critical care RN and a vascular access nurse, and today we're going to be discussing blood patency checks on PICC lines, central venous catheters, and or midlines. So for the sake of this, you want to assess the line first. So when you go to assess the line, we're going to look at the insertion site, the dressing, before we go to actually check for patency. So we're going to look at this dressing right now. The dressing is clean, it is dry, it is intact, there's no bleeding, the site looks good, there's no redness, there's no swelling, there's no pus, exudate, anything like that. The biopatch is nice and clean, it's not saturated. And when we're assessing this, we also want to count how many centimeters, or how many of these little tick marks on this PICC line out that catheter is. And if you look really closely, it does not start at the hub. It starts actually 1 centimeter away from the hub at the 0 mark, and that is where you want to start measuring from. So 1, 2, about 2.5 centimeters this PICC line is out. That is something that needs to be documented with your assessment at least every 8 hours or once a shift. So once again, let's go over. We want you to document how far out the PICC line is in centimeters. We want you to document how the dressing is, if it's clean, dry, intact, soiled, reinforced, if it needs to be changed. We would like you to document the insertion site itself, if it's clean, dry, intact, old drainage, new drainage, etc. And also document the dressing that we're using: a stat lock, a biopatch, and a tegaderm. Now, moving on to blood patency checks. Before I go, I'm going to use my center line here, which is my power injectable 18 gauge line on this triple lumen catheter, and it's already clamped. So when we do this, we're going to take the cap off of our flush, prime our flush. I'm going to take off my green Kuros cap, site scrub for 15 seconds. 15 seconds. Attach my flush. Unclamp, flush a little bit, and then we're going to pull back and see what kind of blood return we get. And we get a blood return. We have our blood return. It's patent. It withdrew just fine. And now we're going to flush that all back in using the push-pause method until we're almost to the end, and then clamp. And now we're going to disconnect our flush, put on our green Kuros cap, and that right there is a patent line. And definition of patency here means that it flushes and withdraws briskly and easily. Now, in the event that you cannot get a brisk, easy blood return, you can try manipulating the arm, having them lift the arm up to at a 90-degree angle. You can try and just make sure that there's no mechanical occlusion or kinks in the line anywhere that can sometimes cause problems flushing and for patency checks. You can also try changing the cap if you're unable to flush and or withdraw. Change the cap per policy standards. The vascular access team designed a troubleshooting PICC patency form, and this is the form. It is a front and back-sided sheet. It is in most nurses' stations in the med rooms, and it's also on the infusion nursing worksite. You can also obtain this by talking to any one of our vascular access nurses here at the hospital. In the event that you have a partial occlusion, which is the ability to flush and the inability to withdraw, you need to, number 1, check for mechanical occlusion. Number 2, change the cap. And if you still have a partial occlusion, meaning that you are unable to get a brisk blood return, at that point you need to instill alteplase. And if you are unfamiliar with instilling alteplase, you can check the policy on it, and or you can contact a vascular access nurse and or PRN nurse, and they are all very familiar with alteplazing lines. In the event of a complete occlusion, meaning that you are unable to get a brisk blood return and you are completely unable to flush after checking for mechanical blockage, after possibly a dressing change, after changing the cap, after manipulating the patient's arm, alteplase. And there's a way to instill that using a 3-way stopcock method, and actually it is on the back of this form right here at the bottom. I'm not going to go over it in this video, but it is on this form. It is on our worksite video, and you can always contact the NAC. You can contact the vascular access nurse, or you can contact the PRN nurse, and those three resources should be able to help you use the stopcock method to instill alteplase for a complete occlusion. Thank you.